just talking about your personal situation, because you are a kidney transplant recipient, and with COVID-19, that has meant an adjustment to your life as well. You're not working. You're one of the fortunate people that has a very loving spouse to support you, but you also recognize the fact that that's not always the case. And you're doing something about that. You're from home and you're coordinating this in order to provide some support, for other kidney patients. That must be a very motivating feeling for you in getting involved with something like this.
It's not only about this year specifically, it's not just about reaching out to the patient and saying, Merry late Christmas, here's your socks, here's your toque. When I started this initiative before, I never once thought that I was going to put, if you are really, really low, here's the number to the crisis line. But it's on there because we're very cognizant that the isolation can be very hard on one's mental health. And it's very important, for myself, it's really important to have at least one phone call or one Zoom call or just like a messenger video chat a day, because that lifts my spirits. And so for someone who doesn't necessarily have a spouse, call your kids, get the grandkids on video somehow. I think a pet is really good for the soul, because when you get home, they're so happy to see you most of the time, especially a dog. But if you have a really loving pet that wants to sit on your lap, that's always so good for the soul too. It's so critical to reach out to your family, to your caretakers if you need the extra help. And we want to let them know that the Kidney Foundation is there too to support them through our programs, like through peer support, Kidney Connect, kidney calls, which is a new thing that we started this year too. I think that we were ahead of a lot of charities, quite honestly, because someone posted for another charity and I thought, we've been doing that for 3 months already. I'm not doing it myself, but we have other volunteers that are doing the initiative with calling patients and making sure that we're checking in and making sure that they're doing okay.
Hi, just calling to see how you're doing today. Oh, that's great.
And so
Really nice.
giving them the option, can I call you in a week? Would you like me to call you in a month? What can I get you? How can I help you? And it's so critical to encourage kidney patients, their caretakers, their family members, to really reach out and get the help that you need, because it's not just about the patient, because kidney disease affects families. When you have a family member living in your home who has kidney disease, it affects everyone.
And this is another great example of just hearing that voice or receiving that item or something that says, we're here for you.
It's a small token.
You were saying there's the message on the socks as well.
The message we're trying to get across with our sock delivery this year is to be particularly cognizant of taking care of your mental health, making sure that you're reaching out and getting the help that you need. When you're at the hospital getting your dialysis treatment, make sure to tell the nurse that you'd like to speak with a social worker. Make sure to tell the nurse if you're having a problem and get the social worker to help you in that way, or reach out through the Kidney Foundation and set up what you need. Set yourself up for success. There's a light at the end of the tunnel. This will come to an end. You'll be able to visit your family and your friends soon.
Annick, this has just been so interesting, and we touched a little bit upon your journey, but I'd love to hear more about your personal journey with kidney disease. Can you stick around for a few minutes and join us a little bit later in the show?
I would love to.
So please stay with us, because Annick's going to join us later in the show to talk about her personal journey with kidney disease and her kidney transplant.